Hello, Michael. It's me, Skyler, your nurse. I'll be your nurse today. I'm going to go ahead and wash my hands for 20 seconds before I start. So I know you have some difficulty communicating, Michael. So we're just going to set up some means of communication. So can you just give me a thumbs up for yes and a thumbs down for no? And if you're in any pain or discomfort, just raise up your hand for me, okay? All right, perfect. I'm just going to finish washing my hands. Get everything here. See clean. Wrist. All right. We're just going to go ahead and look at your wristband. It says Michael Jordan. Date of birth is February 17th, 1963. Is that you? All right, you gave me a thumbs up. All good then. I noticed that you don't have an allergy bracelet, but I just want to ask, do you have any allergies? Specifically to latex, chlorhexidine, or tape? No? Okay, perfect. So today we're actually just going to give you some trach care. So this actually involves suctioning your trach. Also, we're going to change out your old inner cannula with a new one, and then we're going to go ahead and remove the old dressing, inspect the site, clean the site, and then we're going to also add a new dressing for you. And then after that, we're going to go ahead and I'm going to call another nurse to help me assist with changing out your stabilizer for a new one. Sounds good? All right, perfect. Have you ever had your trach care done before? You have? All right. Then this should be a breeze for you then, okay? So are you experiencing any pain right now? No pain? Shortness of breath? A little bit? Okay, so I did take your vital signs earlier this morning, and it was normal, but now your respiratory rate looks like it's at 25, which is pretty high, and your O2 sats is 90%, which is low, so we are going to have to do some trach care and do some suctioning today. Okay? Do you have any questions or concerns before I go and proceed with the procedure? No? All right. I'm going to go ahead and listen to your lungs, okay? Because I do hear some gurgling. So I just want you to take in some deep breaths in and out. I'm going to go underneath your gown. So breathe in, breathe out. Perfect. Breathe in, breathe out. Yeah, so there is some secretions in there. And we do need, in your upper airways, there's some secretions. So we need to go ahead and suction that for you. But before we get started, I'm going to go ahead and check out the emergency supplies that we need to have, which is an inner cannula. We also have an extra suction catheter. There's two trachs, one size of the same size, and there's one that is one size smaller. We also have a suction canister with a suction catheter running at 120, and then we also have an ambu bag connected to oxygen, which is 100% oxygen. And we're just going to verify if it works. Perfect, it works. And we also have an O2 device connected to an O2 source that's connected to your trach. And it's running and it's all good, which is perfect. So now that I looked at the emergency supplies, I'm going to go ahead and start and wipe down the table. So I'm performing hand hygiene for 20 seconds. And then I'll put on some gloves, clean gloves. Okay. I'm going to go ahead and wipe the table down for 30 seconds. I'm going to wipe this down for 30 seconds here. And make sure I remove all these bugs here. You okay, Michael? All right, you give me a thumbs up. Your day's going well? Yeah? Thumbs up? Okay. That's nice. I'm going to go ahead and keep on wiping the table down. Sure it's nice and clean. I'm going to go ahead and get the edges. All right. Now that we wiped that down, I'm going to throw that away. Check out these gloves. Perform hand hygiene for 20 seconds. I'm going to let this air dry for 2 minutes. And now I'm just gonna close the door, put up the privacy curtain up. I'm gonna raise patient up to high Fowler's position. And Michael, are you in a comfortable position right now? You are? All good then. Okay, we're gonna go ahead and continue with our procedure of suctioning. But first we're gonna prepare our supplies. So I'm gonna wash my hands for 20 seconds. Then I'm gonna put on some clean gloves. And then we're going to go ahead and bring our supplies to the table here. Grab everything. So we have a sterile saline bottle. We also have an inner cannula. And we also have a suction catheter. And a stabilizer and a trach care kit. So I also noticed that your suction catheter is at 120. But I don't know how old this is. So we're going to go ahead and replace that right now. We're going to grab in. From this, get a clean one. We're going to remove the old one. Okay, like so, and then we're going to go ahead and put on the new one. Alright, now we're just going to let it hang there for a bit. And then we're going to go ahead and open this. Throw this in the trash. We're going to open it up, and we make sure we have the sterile part inside that we're not going to touch. We're going to go ahead and open the trach care kit. Like so. Then we're going to grab the sterile gloves, which we don't need, so we're going to go and throw that away. We do need this sterile drape, so we're just going to open it up. Like so, grabbing the edges, and then we're going to put the shiny side down. Like so. Okay, and then now that we have that into place, we're going to go ahead and grab the inner cannula. Drop it carefully in there, which is perfect, and throw that away. Then we're going to grab the sterile saline and shoo, and then shoo into the tray and into the box. And then that's it. Now that we have that prepared, I'm going to remove my gloves, toss that away, perform hand hygiene for 20 seconds. Okay, Michael, we're going to go ahead and actually hyperoxygenate you because your SATs are 90%. But after suctioning, if we do see that your SATs are still low, we might have to hyperoxygenate you again. And we will just hyperoxygenate you right now with this ambu bag. So first, I'm going to go ahead and wash my hands for 20 seconds. And I'm going to put on some clean gloves. Put these on. Okay, and then I'm going to hold your faceplate. I'm going to remove the O2 device, like so, and we'll grab the ambu bag. So we're going to give you 3 breaths, and we're going to wait 6 seconds after each breath. Okay? So I'm going to go ahead and hold your faceplate down and put the ambu bag. So we're going to give you 3 breaths. 1, 2, 3, 4, 5, 6. Second breath. 1, 2, 3, 4, 5, 6. Third breath. 1, 2, 3, 4, 5, 6. Okay, I'm going to hold the faceplate, remove the ambu bag carefully, and put this back here. And it looks like your O2 SATs is up now, so it's 98%, which is good. So we're going to go ahead and hold down the faceplate, put back the oxygen device here. And then we're going to go ahead and get my suction catheter ready for you so we can suction you. Jeez. Alright, now we're going to go ahead and prepare the suction catheter. We're going to take this out for about an inch. Test it. Perfect. We're going to put in this normal saline. And then, alright, we got some normal saline in. So now I'm just going to close this for a second. This here. Remove the oxygen device like so. Okay, we're just going to go ahead and take this out again for an inch. I'm going to actually suction some more normal saline. Alright, Michael, we're going to go ahead and suction your trach now. So we're going to go ahead and insert this for 3 seconds and then pull it out slowly. Alright, so ready? You'll be coughing once I reach the farthest I can. So we go 1, 2, 3. Alright, perfect. Looks like we suctioned enough in here, so we're going to go ahead and rinse this out. Alright, perfect. Now that I put that there and rinsed it out, I'm going to go ahead and hold the faceplate down, and we're going to put on the oxygen device. Actually, yeah, we're going to put on the oxygen device, which is all good. And I'm going to remove these gloves. I'm going to wash my hands for 20 seconds. Okay, Michael, now we're going to go ahead and change your inner cannula, and we're also going to remove the old dressing, clean the site, and then put on the new dressing for you, okay? All right, now I'm going to perform hand hygiene for 20 seconds. Put on some clean gloves, like so. All right. Now we're going to go ahead and replace your inner cannula. I'm going to hold the faceplate down, remove the oxygen device like so. Then we're going to go ahead and remove this inner cannula, the old one, and then toss that in the trash. I'm going to grab the wings, not grabbing the inside, like so. And then we're going to put this in carefully, like so. And then clip it on, like so. All right. You feeling okay, Michael? No pain? All right. Now that we got the new inner cannula in, we're going to go ahead and remove this old split gauze so we can assess the site. Toss that away. Okay, and now we're going to look at the site. So there's no redness, no swelling, no signs of infection, which is good. Just a little dirty, so we're going to go ahead and clean that up for you, okay? So we're going to grab a Q-tip right here. We're going to dip in sterile saline. We're going to swipe once under the faceplate, like so. And then we're going to grab the other swab, dip in normal saline. We're going to swipe once on the top, like so. Then we're going to dip this gauze into normal saline and wipe once under, like that. Then grab another gauze, dip into the normal saline, wipe once on the top, like so. Toss that away. Then we're actually going to dip this last one into normal saline, and we're just going to pat and wipe down the faceplate here, like so. And then I clean the faceplate. I'm going to get a dry gauze here, and we're going to go ahead and pat dry the skin and around the faceplate, like so. Okay. And we'll get the split gauze here, and we're going to put it in carefully while still holding the faceplate. Okay. All right. Doing good, Michael. Just need to put up this gauze like that. All right, perfect. Now we're going to go ahead and put back the oxygen device while holding the faceplate. We're going to go ahead and toss this drape away because we don't need it. I'm going to remove my gloves. Wash my hands for 20 seconds. Okay, Michael, looks like your stats are still 98%. Respiratory rate is 16, which is much better. You're doing good, Michael, okay? All right, so now actually we're going to go ahead and change your stabilizers. But I'm going to go get another nurse. So I'll go ahead and throw these away because I don't need these. Put them in the trash. I'll keep the saline here just in case we have to resuction you. And just in case we do have to resuction you, I would have to wait 30 seconds before I suction each time. So that would be important. So we would wait 30 seconds to resuction you. So I'm going to go ahead and get my other nurse to help me change your stabilizer. I'll be right back, Michael. Hey, Michael. We're back. I'm here with my colleague, Nurse John. Say hi, Nurse John.
Hello, Michael.
We're going to go ahead and remove your old stabilizer now and put on a new stabilizer for you, okay? All right, perfect. So me and Nurse John are actually wearing a face shield and mask, which we need. We're going to go ahead and perform hand hygiene, both of us, for 20 seconds. And then we're going to go ahead and don clean gloves, both of us. As so. And then we're going to go ahead and replace your stabilizer with a new one. So I'm going to go ahead and secure the faceplate and remove the oxygen device. Now Nurse John is going to secure the faceplate, and I'm going to go ahead and remove one side at a time. And we always remove one side at a time and put on one side at a time. So while he's holding the faceplate, I'll remove this side. I'll tuck it underneath for him to grab. I'm going to do a quick neck assessment. There is no signs of swelling, redness, or infection. No skin breakdown, no drainage, which is good. So now that we remove that, we're going to go ahead and have Nurse John still hold the faceplate while I grab a new stabilizer. I'm going to go ahead and throw this in the trash, the packaging, and Nurse John is still holding the faceplate. I'm going to go ahead and put one side at a time of this stabilizer, like so. Like so here. And then we're going to lock that, and I'm going to go ahead and give this to Nurse John. Now it's my turn to hold down the faceplate, and Nurse John will remove the old stabilizer one at a time and then put on the new one. So he's going to remove this one, as so, and then he's going to throw that in the garbage. He's going to go ahead and do a quick neck assessment on that side.
No redness,
swelling, no signs of infection, no drainage. Perfect. I'm going to go ahead and put in the new one. As so. Perfect. Now I'm going to go ahead and make sure there's 2 finger space here, which is good, so it's not going to be too tight around your neck. So now I'm going to go ahead and secure the faceplate, put on the oxygen device like so. Alright, that wasn't so bad, right, Michael? Perfect. So now I'm going to go ahead and look at your vital signs. You have respiratory rate of 16, oxygen sat of 98%, which is good. Are you experiencing any pain, shortness of breath? No? Alright, perfect. I'm going to go ahead and do a quick check on your lung sounds, okay? So we're going to give me a deep breath in and out, okay? Breathe in, breathe out, 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 breathe in, breathe out. Alright, so you do not have any, you have clear breath sounds, which is good. And you also have a new clean suction catheter in place, which is good. I'm going to go ahead and give you this call light, which you can use to call me whenever you need anything. I'm going to go ahead and dispose of this container and the normal saline into that garbage, like so. And then I'm going to go ahead and remove my clean gloves, throw this in the garbage, perform hand hygiene for 20 seconds. Then I'm going to exit the room to document the date and time of the procedure. I'm also going to document the tolerance of the patients, which he tolerated well. I'm going to document the site assessment of the neck and the trach, which showed no signs of redness, swelling, or infection. I'm also going to document the color, amount, and consistency of the sputum, which was thick, white, and clear with moderate amount. I'm also going to document the vital signs of respiratory rate of 16, O2 sat of 98%. And I'm also going to document the respiratory assessment, which the patient had no shortness of breath and had clear breath sounds. And that's it. Bye-bye.